dear, open a little. So what I'm doing here, I'm actually using a 1-inch Teflon tape to cover my suture, so when the acrylic actually doesn't get on the wound. So we just marked it by pressing it on the abutments, and now I'm going to take it off, and we're going to use a rubber dam punch to make the holes. Just run right there. Go ahead and do that. Okay, I think we have the denture. Let's try it on. Good. So it fits. Greg, I think if we can cut the back so I could have her, bite down. Can we cut this? Just shorten the cylinders a little bit. Because I don't want her to be too forward. I think we're seated. Open, my dear, a little bit. I want to check if the back is seated. So yeah, let's cut the cylinders a little bit. Yes. Okay, so I think if we can cut it right there. And that right there. Okay. So they're marked well. Let me put that down over here. 4x4 gauze. Okay. So I'm going to unscrew the cylinder so we can reduce the size. Keep that on the side for now, Helder, because we're not ready for that. Okay, Greg, so this is the right side. Love it. So important to work with experienced dental technician. Here's a little screw. Okay. Makes my life easier. Yeah. Okay. So the reason why I want these shortened to begin with is because I want Anna Maria to be able to bite down just to make sure this prosthesis, when we pick up these abutments, is not too far forward. Okay, there we go. We're not going to put on the white caps. I think we should be okay for a few minutes. Okay. I'm just going to put a bit of pressure over the ridge here. Let me see the Teflon tape. Make this more interior. Make this one more over there. Let's take another one. Give me another one. Let's try another one. Right here, Helder. Isn't that it or no? Okay. We can kind of make it based on the other one. you want me to press it down? If you need to put on a piece of paper on this and punch through both, you know what I mean? Or just, this, it might be easier.
Dr. Moldovan.
Yes.
Dr. Harris here. Could you explain why you're using Teflon tape versus rubber dams?
Good question. The rubber dam tends to be a little bit thicker, and it doesn't adapt to the tissues. What you'll see shortly is like the Teflon tape will actually stick like saran wrap to the tissues, and I usually use a Q-tip to set it in place, and it doesn't move. But the rubber dam, you know, it just has memory, and it doesn't adapt like saran wrap. And second reason, Teflon tape is a lot thinner than rubber dam, so you won't get that space between the denture and the rubber dam. Good? It's okay, no problem? Great. I have 4 cottons here for the screw axis all. So, yeah, look at the cylinders and I need her to bite. Give me 4x4 gauze. Looks like Greg is ready. He's coming back. So we'll get ready to place the cylinders back on. Almost time for lunch. We're getting there. So what'll happen next, I'm going to put the titanium sleeves here. Perfect. Screwdriver, please. We're going to start with the right size. Yeah, the 4x4 is in. Right side. You see the marked right? That's the one we're going to start with. Make sure we have no bleeding here. There's a little bleeding there. If you can rinse it off, that'd be great. I think it dried up a little bit. So what happens is it'll get sticky there. Try to keep these as clean as possible. Good. Anna Maria, open for me, my dear. Thank you. Sorry to wake you up here. Okay. Again, I need to clean the cylinders, the abutments first. A little bit of water. Okay. Okay, one more sleeve. Good. Let's check the denture. Actually, yeah, and then we can put the go ahead and bite down, my dear. Bite down all the way. Okay. Good. Yeah, she's hitting on 7. Okay. 7 and 10, just a little bit, I would say. Open a bit. Posteriors are great. Let's see. Here's my little marker. Alrighty. Okay. There we go. 4x4 guys for the posterior. A little bit more reduction here, just so I could have her fully close. Obviously, we don't want to take too much off. This is done. There we go. Okay, so let's put on, we have the other two that are working, so we're going to put on our Teflon tape here. I want to dry this ridge. Take that off for a second. I'm going to need a Q-tip. Wet, just wet it for me. Okay, so you can see here, you can actually tap this. over the area here. I'm going to stretch over the last abutment. And I should be able to still seat the multi-unit abutments even after I place this.
Can we switch the monitor to the patient, please? Thank you.
Con plier, please. Sakta. It's a little bit of a bigger gap that I like it to have, but I don't have any knots there, so I'm not too worried about it. Here I need to remove the little loose piece right there. But essentially, this will just help me cover all the stitches here. And you just take a wet Q-tip and adapt it onto the tissue. Don't suction at all, please. Okay. There you have it. Just want to make sure none of the Teflon tape is sticking onto the abutments. It is a little bit over here. Yes. Go ahead. Remove a little bit of it from the abutment here. And see, even if you have a fold in it, it's still thin enough that I could seat this. Okay. Ready? Awesome. Okay. I need a 4x4 gauze. So that one was 7, yes. All right, I'm going to just a little gauze back there. Make sure nothing drops down. Great, one more. Yeah. Just want to make sure this one's seated. Let me have an elevator here and a probe. I'm catching a little bit of the Teflon tape here, so. Okay. And suction there. Okay, perfect. Looking good. All seated. I can see here on the palatal that it's fully seated. Let me go ahead and bite down, my dear. Bite down. Okay, good. I'm going to take this out because we definitely want to see in the smile. Make sure this is not crooked. Very nice. Okay, so we know that's how we want in this position, maybe a little bit. Go ahead and bite down one more time. Make sure. Okay, good. So the midline's right on. Perfect. Open. Okay. So I think we're ready to load. We prepared already some cotton here for the screw access holes. This might be a little too big. Let me have a smaller one. This is right here. I'm just going to start with a smaller one here for the front. Even smaller than that, Helder, for the two anterior ones. Give me a probe. So we just want to make sure that no acrylic is going to go in the screw access hole. Good. And let me put this one where it needs to be. Excellent. Let me have a Q-tip, please. Not a, yeah, clean one. I just use it to press here. Okay. I'm gonna make sure these are dry. This moved a little bit. Let's put it back in place. Retract. And very important to keep the area as dry as possible here, especially the cylinder. See, as soon as we took out the retractor, has a tendency to do that. So go ahead and give me the horseshoe retractor for now. I'm going to put that in place just so we can dry the cylinders properly. And then, okay. All right, Greg, I think we're ready. Go ahead and dry it, Helder. Yes, go ahead. Greg, go ahead and start mixing, yes. Okay, Helder, so I need the Q-tip aside and an instrument so I can remove the excess acrylic from the access holes after I seat the denture. Perfect. Right here, go ahead and bite down. Let me see. Bite, bite, bite. Bite together. Open. Open for me. Hold, Helder. Hold right here. Hold the retractor. Awesome. Okay. So I'm injecting the acrylic all the way around. I want to make sure that it gets in all the proper places here. And last one. Okay, hold that. Just want to make sure we secure it all the way down and around. Want to bite down for me, my dear? Take the retractor out. Okay, bite down. Hold it tight, okay? Hold it. Hold and squeeze, okay? All right. I need it back. Perfect. Open. Yeah, we can see here. Want to make sure that these are completely uncovered here. Very, very important. Don't rush this point, okay? What happens is we want to make sure that this stays in place. Go ahead and suction for me, Helder. Keep it as dry as possible. The back of the throat a little bit there. And I want to leave the acrylic here to really cure for a good 5 minutes. Maybe 10. So at this point, you can, what we're going to do, just wait here. So if you guys want to go to lunch, you can do that. And what we're going to do, I'm just going to give this to Greg to finalize. And if you guys want to stick around and watch your mastery, absolutely. Yeah, so perfect. Yeah, it's getting warm. Definitely don't want to remove this until it fully cools off. Yeah, very nice. I'm going to wait till the heat fully goes away. Let me remove this for me a little bit. It's already hard in there. Greg will remove it. So what could happen is that maybe one of the abutments didn't get picked up, so we might have to go back and secure it. We're going to find out. I can remove the cotton try to get this acrylic off here so I can put in the screwdriver. Okay. Good. I need a 4x4 gauze. Quite a few. Okay, good. I can engage there. Good. Not yet. Just want to wait a little bit longer here. Is it cooled off yet? Or almost, still warm. Still warm. Yeah. Safe to remove it? Okay, hold on. Sometimes the screws come out, sometimes they don't. Let's see. Always have extra screws. So you never know when you lose. I mean, if you see how small these are, there you go, Helder. You can. Yes, especially if you have gray floors. See, I mean, look how small these screws are. So, make sure you have extras. I'll put it in there. Three, just make sure this one is fully. Still in there. I have one screw still in there. So, okay, looks like it's stuck on the acrylic there. So what first thing I'm going to check to make sure these are fully engaged. Cotton plier, please. Yeah. Engaged. 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 Perfect. So back in the lab, I mean, I could take off some of this Teflon tape. It just peels off. All the sutures are intact. I don't see any sutures stuck on here. Okay, so here we have it. All right, we have all four engaged. So Greg, what he's going to do is just going to finalize this in the lab There's a little void right there, but overall it picked up well. Yeah, okay. Here you are. There's one screw still actually on the other side. Yeah, the number 7. Okay, so in the meantime, we're going to put on some white caps. Okay, because it's going to be a little while until we finalize this. So let's put on some white caps. Just to make sure the tissue doesn't close. Horseshoe retractor. Okay. Last one.
Doctor,
Yes,
if we have to leave the patient at this stage,
yes.
how late or how early we can go back to code?
So from the literature we know that the bone actually, around the implant, starts remodeling, and after a week it's not safe to screw and unscrew things over the implant because the osteoclasts started doing some resorption, some remodeling already around the implants. So I would say within a week is safe, within 5 days, to screw and unscrew things over the implants. And then of course it depends on the stability of your implants as well. Ideally, I like to load things the first day, but I know some practitioners actually wait until the next day to finalize the prosthesis, especially when you don't have a lab close by. Luckily, DaVinci actually travels when I do these cases, so we're able to do these cases all under one roof. Greg is right next to me. I hand him the prosthesis, and he does the conversion. That's the ideal. A lot of my patients, again, have teeth, a lot of my cases, so they don't like to go home without teeth. They're here because they don't want to end up with a denture. So they want to wake up and they want fixed teeth. There's definitely a phobia out there about, having dentures. So it's a great, this treatment is a great treatment for dentate patients who have terminal dentition. We have to remove it, and then we can give them something fixed essentially the same day. Okay, so I think at this time, let's head to lunch. I'll see you guys out there. I think we're all hungry. You have a smoothie. And when we come back from lunch, I'll talk a little bit about what we did and some of my experience. I'll share with